Good morning, Chris Ohl, Wake Forest School of Medicine, Infectious Diseases. Mid-December, time to get your Christmas shopping done. How are we doing COVID-wise? A few things to talk about this morning. First of all, our cases are continuing to go up as we sort of predicted going into the holiday season. And we here in Forsyth County, we're at 34 per 100,000 per day. I think last week at this time we were about at 26. Down in Mecklenburg County it's a little bit lower, 27 per 100,000 per day. And Guilford's about 27 per 100,000 per day. All of those three locations are increasing in numbers. But if you go a little bit to our west and a little bit to our north, or in the Charlotte region, you go down outside either east or west, you'll see an increase in cases that are proportionally higher than in our more urban areas. The county leading the case count now in North Carolina is Yadkin County, just to our west. Not quite as a populous county, so by absolute count, not quite as many people getting it, but it's at 74 per 100,000 per day, which is uncomfortably high. Same thing just to our north, Stokes County and Surrey County. Wilkes County, which got hit really hard with the Delta surge in August and September, is about like what we are in Forsyth County. So a little bit of specifics on our numbers there. I think they'll continue to go up. Some of the reason for the increase in the past 4 or 5 days is because of Thanksgiving. People getting together and traveling. And if you remember, our travel during this past Thanksgiving was the highest it's been since the pandemic, and actually back to about pre-pandemic Thanksgiving loads for the airlines. So people getting together, people get exposed, virus transmits. We're 100% Delta virus now in North Carolina and here in the Triad and down in the Charlotte area. And that's not good because Delta variant, as we've been talking about for the last 7 or 8 months, is more transmissible. I was looking at data out of England again, and then comparing it to data here that we have here in the Triad about the severity of Delta compared to the old wild-type virus, which seems pretty tame right now. The severity of infection due to Delta is clearly higher. How much higher? Modestly, but I can tell you that it's probably about 2.5 times more likely to land you in the hospital. And that I backed up here in the Triad using ratios of cases to hospitalizations. So if you look at the number of hospitalizations here in the Triad during our Delta wave in September and October, and you compare it to the number of cases, you can get a ratio. And then if you look at that same ratio with our December-January peak last year, the number of hospitalizations is higher compared to the number of cases. And so all this talk about Omicron, is we haven't gotten through Delta yet, and Delta is what's getting people now. Delta is more transmissible than the initial wave, and it's a little bit more severe. More likely to land you in the hospital. So our hospitalizations following the number of cases going up also have gone up across the whole state actually, including in Mecklenburg County and here in Forsyth County and Guilford County. Roughly a 40% increase in hospitalizations in those areas over the last week. Still almost all unvaccinated people landing in the hospital. It's no different than it was in August and September, which is really unfortunate because those hospitalizations, each one of those is a potential preventable occurrence and by vaccine. So, how are our schools and universities doing? Public schools are hanging in there, and congratulations to Davie County. I see their school board just voted to go back to a mask mandate in their schools. I fully applaud that, and that's a great idea. It'll help you get through the next coming months of respiratory virus season. Wake Forest University is still wrestling with influenza, the flu, and in fact the number of cases of flu there over the fall semester is greatly higher than the number of COVID cases. Who would have imagined that? But it goes to show you what a high vaccination rate for COVID will do in a community that's closed like Wake Forest. Some aspects about treatment. We've been talking about oral drugs over the last 4 months or so that would be coming out for COVID. First one that will be looked at is molnupiravir. So the FDA Advisory Committee voted somewhat narrowly to that molnupiravir would have a benefit over risk here in the U.S. Interestingly, the FDA proper has not yet acted on an EUA for molnupiravir, which means that they're scrutinizing the data and looking at it, and there may be some concerns. What would be the concerns about this first drug, molnupiravir, is that the efficacy, in other words, its effectiveness, doesn't appear as high as it did back in the early data in the first part of October. In fact, it's about a decrease from roughly 9 to 10% hospitalization and in people who are treated with it versus about 6 to 7%. So not a big drop. The other thing is the way the drug works is by inducing mutations in the virus. And so you can't give this to pregnant women because of a potential of a concern of having problems with doing the same thing to a fetus. It's not been seen, and the animal experiments don't suggest yet, but it's still enough of a concern. You can't give it in pregnancy. In fact, I think it'll end up being you'll have to show a negative pregnancy test to get a script for this. But the good news is Paxitol, which is right behind molnupiravir in the approval process, different drug, acts in a different way. It looks like it has much greater efficacy, and it doesn't have any safety concerns. We'll just have to be a tad bit more patient waiting for an oral drug. But I still suspect by the time we get into January, we'll have that. Another drug that's out is a monoclonal antibody, Evishood, I think is the way it's pronounced. This is a depot monoclonal antibody. What is a depot? It's when you get an injection and then it stays in those tissues and slowly etches out or releases the active component into the bloodstream. And so if you get an injection of this monoclonal antibody, you have 6 months of antibodies that are circulating. The way that this drug will be used in the most effective way will be for giving immunity to immunocompromised people who don't respond well to the vaccine. So particularly people with certain kinds of cancer or who are on certain immunologic therapies or have had organ transplants. When you vaccinate them, their antibody levels don't go up as high or last nearly as long. So this is a way of supplementing this differently. How well will it work against Omicron? We'll have to wait and see. The Omicron, we've got more information now than we did last week. And there's a few things that I'm pretty certain of now. One is that this virus is definitely more transmissible than the wild type virus, and this is based on information out of South Africa and now Europe, Northern Europe, and to some extent the UK. Is it more transmissible than Delta? I'm thinking so, but I can't tell you 100% for sure yet that it's more transmissible than Delta. But it would not surprise me if it isn't. extremely more transmissible than Delta? Likely not. I'm thinking maybe somewhat more. It is, though, early information seems to be that this virus is not any more severe in the infection it causes than the wild-type virus. Well, Delta had a modest increase in severity for the types of illness. This one may not have. But it's still a little bit early to know, so we have to see more. But this is based on number of cases versus hospitalizations in South Africa. And we have to see that confirmed in other places and other areas. But that would be very welcome news if that's the case. The other thing is that we know is that Omicron is a little bit more adept at evading pre-existing immunity to COVID compared to Delta. We know this for a couple of reasons. One is that reinfections in South Africa are a lot more apparent than they were with Delta earlier on. What does reinfection mean? Is somebody who had previously had COVID and then gets COVID again. That's a reinfection. So it looks like that pre-existing immunity from prior infection is evaded to some extent by Omicron, much more than Delta. The other thing is that we now have some neutralizing antibody studies where we take blood from people and get the antibodies out of that blood and serum, put them in a test tube with Omicron variant or a pseudovirus type, and then look to see how much antibody to virus attachment and neutralization occur. And that neutralization is reduced with Omicron compared to wild type and also compared to Delta. So if you want to look at it, wild type, those neutralization studies from serum from previously infected or vaccinated people is robust. Delta's reduced somewhat. Omicron's reduced even more. That you have to, though, be a little bit careful when you see the media reports on these studies, because there's labs all over now who are doing these neutralization studies. South Africa showed a really big drop in neutralization. Studies in Northern Europe showed a much smaller drop. Studies otherwise, it's kind of in between. And so all of these people in labs who are looking at this, rather than putting their results through the usual peer review process where scientists like myself can look at it and say, hey, did you think about this? Did you do this? You should have done this, is averted. It doesn't happen. And a lot of these labs are just putting their data, their raw data, out by Twitter and other social media accounts. And so it's really hard to know what they're really showing. So be a little bit cautious, because you're going to see media reports all over the place about how much reduced previous infection or vaccine is for Omicron. It's better to look for a source from an infectious disease doctor who you trust and respect, like me, rather than going straight to the media reports. I'll tell you, it does look like that Omicron does evade some previous immunity. What we still need to know is whether or not that's significant enough so that that vaccine, the 2-dose series of vaccine, is not as protective for severe disease or hospitalization. Early data out of South Africa suggests that messenger RNA vaccine, even the 2-dose series, still protects against severe disease and hospitalization. But we'll have to see how that looks in Europe and the US. I can tell you one thing, though, that getting a booster increases the antibody levels considerably to a level where neutralization of the virus is almost up to what it was before Omicron. So What does that mean? It means boosters probably are ticket out of having a major impact from Omicron. And so early on when we were talking about boosters, myself was saying, wait a little bit, it's okay, it's not an emergency unless you're immunocompromised or older or have comorbidities. Right now I'm saying it's time to get off the fence and go get boosted. We don't need to wait anymore. Let's just go do it. And if you had a breakthrough infection, you were previously vaccinated and you had a breakthrough infection, you want to get boosted anyway. Don't let the breakthrough do it by itself. So I had my breakthrough infection on Labor Day weekend, just roughly last year, so that was about 90 days ago. I'm getting my booster tomorrow. So anyone from Wake Forest, employees, staff, who wants to join me in getting boosted tomorrow, let's go down and do it. I want everyone boosted who's been previously vaccinated in our health system, in our community, in our state. And that includes all my colleagues down in Charlotte, my friends and colleagues in Guilford County and any other area where people are listening. Let's get boosted. Let's get it now before the holidays. If you get boosted now and you get it before the holidays, I think the impact of Omicron on you is going to be small. There may be some breakthroughs, wouldn't surprise me, but it'll be largely minor annoyances rather than more severe infections. So I couldn't be more emphatic and supportive of getting a booster right now. How are our vaccination rates doing? Speaking of vaccine, we have, I think it's 58% of people over the age of 12 vaccinated here in Forsyth County, 68% in people over 18. We're getting itching up there in kids now. Kids now have had the opportunity to get 2 shots, and those between 5 and 12, and so we're seeing increases in that area. I think we're up to 15% with 1 shot in Forsyth County for 5 to 12. So let's get our kids vaccinated. And the rates in Mecklenburg County are really not much different, actually. The good news is it's continuing to go up. We are still seeing people coming in for their initial vaccine series. And talked to someone the other day, an old friend who I ran into, and said, I haven't gotten vaccinated yet. We talked for a while, and he assured me he'll be in this week to do it. So people are still getting their initial vaccine series. The boosters need to be given 6 months after your initial vaccine series for the messenger RNA vaccines. That's Moderna and Pfizer, or 2 months or more after Johnson & Johnson's. So I think, though, more of our appointments now are for boosters than for initial vaccine series, but it's running about equal. So as far as public health goes and preventing transmission and the impact of COVID on any community or population, getting unvaccinated people vaccinated is going to be a bigger deal than boosting. Flu season. Yes, it's here. We're seeing influenza. I mentioned earlier in universities, it's been kind of a particular problem. But in our community at large, we're seeing it too. So get your flu shot in addition to your booster shot. Just a reminder, you can get your booster shot and flu shot at the same time, or you can get them separately. You don't have to wait a 2-week period or separate them at all. If you want to get one today and one tomorrow, you can. It's probably more convenient just to get them both at the same time. But I think, as I've been saying for the last month or two, that our respiratory viral season this year will be a mix of COVID. It'll be a mix, in there will be some flu and some of the other viruses as well. that we normally would see. So I still predict that our COVID wave that we have over the respiratory virus season over the next 2 to 3 months will be nowhere near as big as what it was last year. Last year at this time, if you remember, we were starting to really struggle. This year, cases are up, but we're hanging in there. So even with Omicron coming, we will get by, we will survive. And so with that, any questions?
We have a few. The first one is, this person originally received Johnson & Johnson. They got the Pfizer messenger RNA vaccine recently, and they didn't know if there was a time they should get a booster. Like, do they wait 6 months and get a booster?
So if you got originally the Johnson & Johnson vaccine, and then you were just boosted with a messenger RNA vaccine, like either Moderna or Pfizer, that's still considered boosted. And so at this time, you don't need another one. You might in the future, but right now. Just to where the companies are working on an Omicron-specific vaccine, which covers Omicron, Delta, and the previous viruses. It doesn't look like that would be available until March if we need it. But if it looks like our current vaccines and boosting provide enough protection against hospitalization or severe disease from Omicron,
household, is there any recommendations you have above and beyond like the home test?
The question is if you have a family member who's unvaccinated and wants to come for an unmasked weekend, let's say a holiday activity, do I have any recommendations on how to proceed with that, other than getting a home test for that person? The short answer is no. I mean, you can test that person, the day before they come, and even daily using home tests. That's fine. If that unvaccinated person has health problems, or if anyone in your family also has health problems, that really increases the risk of things. A lot of that comes into family dynamics and talking with people, and it's probably best that the event doesn't happen, particularly if people have health problems in that group or they're older. But short of testing, that's really all you can do.
And the last question we have is, if you got like Moderna in your original 2-dose series, is there any benefit of getting Pfizer and then vice versa?
Yeah, so if you got Moderna in your original 2-dose series for vaccination, is there any benefit to getting Pfizer as a booster? The mixing and matching thing seems to be that it does provide a little bit of benefit. Whether that benefit is enough to make it worthwhile, I would say if you go to get your booster and they say, well, all we got today is Pfizer, you'd say Pfizer is good enough for me. Or if they say, all we got today is Moderna, you say, Moderna is good enough for me. If you look at just the science of it and the data, changing that third dose might give a little bit of benefit. But whether it's enough to make a difference, I'm not sure.
Do you recommend boosters for the lower age groups, not under 18?
Yeah, so boosters for the lower age groups, you can boost down to 18. And right now there's no emergency use authorization for a booster for under that age group. So most of our kids were vaccinated later anyway, compared to those of us who got it, like, say, in January. And so their immunity is still hanging in there. Kids respond better to vaccines than adults do anyway. But I'll suspect that we will start to see some guidance on what to do with our kids just after the holidays. But right now, I wouldn't worry about it. I think the kids are still good to go who've gotten their primary series of vaccine without a booster. And check back after the holidays and we'll see if there's guidance then. All right, we'll see you next week. Next week, I think we'll go back to 10:30. And so tell your friends we'll be back at 10:30 for next week. Have a great weekend.